Our next speaker also has a breadth of experience in the bridge building arena. Alexia Kelley, as already just mentioned, is with the Department of Health and Human Services, where she is the director of the Center for Faith-Based and Neighborhood Partnerships. Will you please welcome Alexia Kelley? Alexia?
Hi, everybody. Thanks so much for having me. It's really a privilege to be here with you, and congratulations on your 50th birthday. This is really just a thrilling evening and occasion. I want to bring you greetings from my boss at HHS, Secretary Sebelius. Our center at HHS is in the Office of the Secretary, and as Ari said, we work in collaboration with his center and 12 other centers, as well as in close partnership with Joshua Dubois' office at the White House. I really want to thank IMA and President Richard Santos for your 50 years of leadership in faith-based partnerships and initiatives on addressing critical public health challenges. And as I just delved a little more deeply into your work preparing for this evening, it became clear to me that your work really demonstrates the value of those kinds of faith-based partnerships in addressing those critical public health challenges. And you really brought to light what we talk about a lot and hear so much from our partners in the field, what the critical criteria are for effective faith-based partnerships. As a faith-based organization, you know partners in the field who know communities well and who can get resources like the incredible contribution from Tom's shoes that you've secured to the right people, especially to harder to reach populations. And you're also a trusted messenger as a faith-based organization who can deliver public health messages in an effective and convincing way in the field. And as you know better than others, in many parts of the world, and particularly in sub-Saharan Africa, almost 70%, this is a WHO statistic, of health services are delivered by faith-based organizations. Our center serves as an open door and an advocate for partnerships such as the ones that you innovate across the world. And so I just want to make sure that all of you here are aware of our work at HHS, and we seek to be a voice for these kinds of partnerships with faith-based organizations. We were very privileged to work with IMA World Health and other partners, including the Center for Interfaith Action Against Global Poverty and World Health Organization, to create a protocol to identify religious and community health assets in the developing country context. Knowing where services are is key to accessing them, and once those services can be identified on a map, they can be utilized and linked to others. And we learned much of this very well from IMA's Scott Todd, that a map is to program decisions what a budget is to financial decisions. So IMA has really demonstrated that creating these maps is possible in resource-poor settings where access to technology is low. So we look forward to continuing to work with IMA and other partners to develop and apply these models in order to improve community and religious health assets mapping domestically as well. I want to thank you for your incredible leadership and work in Haiti, both before the earthquake and then since the earthquake in January. I know that you experienced personal loss in the earthquake, and we want to extend our sympathies for that loss. We also lost HHS staff there in Haiti and still feel that loss profoundly. I want to just mention a few of the ways that HHS continues to be involved in Haiti. Our center in particular, in many ways, applying what we learned working in partnership with IMA, co-chaired with the Office of Global Health Affairs at HHS, a Haiti Health Facilities Working Group. And this was an international consortium, mostly of NGOs and federal government partners that worked with the Haitian Ministry of Health to develop a database of the health facilities in Haiti. They're moving forward now to develop a real-time database of information on the capacity and services and needs of health facilities in Haiti. Our Office of the Assistant Secretary of Health continues to provide consultation and work in close collaboration with the Haitian Health Ministry, and they are working with the Office of Minority Health in coordinating and supporting the consortium of U.S. universities and organizations that are working to help with the Haitian Health Ministry rebuild medical education in Haiti. And as you all know well, CDC continues to provide work and collaborate closely with the Haitian Health Ministry. They've been in the country since 2002. And I'm aware of just some of your incredible work in Haiti to develop, for example, a Healthy Kids Kit in the aftermath of the earthquake, as well as Safe Motherhood Kits, which has done an incredible, made an incredible contribution to improving childbirth safety for women and their babies. So I want to thank you for your work in Haiti, for your work around the world, and just congratulate you for your leadership and continued partnership efforts. So thank you so much, and happy birthday.